Now, the whole concept around self-insemination came in, once people saw that IUIs were working. So that insemination cannula, which are known as IUI cannulas, and a specimen container for the husband or the male partner. ये पहले भी जैसे वीडियोस में बताया है, इंडियंस में स्पेशली 8% लोगों में Hi friends, I'm Dr. Shweta Goswami and I welcome you to Fertility Fridays. It's the place where we wish to welcome hope into your lives as soon as we can. So today we'll talk about probably a less commonly discussed topic, but I think a very common and a pertinent one, which is how to conceive naturally if you're having difficulty, in planning or having intercourse. So there is something known as intravaginal insemination or self-insemination that I wish to talk to you about today. So one, unfortunately, especially in a country like India, I think it's a big taboo, to be talking anything regarding if we have problems with intercourse or sexual problems. However, it amounts to a decent, at least 10% cases of couples who struggle with fertility issues. One, sometimes men can have erectile dysfunction issues. Two, in women, there is a condition known as vaginismus, where there is an involuntary contraction of muscles because of which they are not able to procreate. Third, it is actually something that happens to every couple who's undergoing, maybe fertility issues or finding it a little longer time to conceive, because it's all a psychological issue. So sometimes even otherwise healthy couples will actually come up and say that it's in the fertile window we find it, difficult because it's become more like a program thing. However, otherwise when we don't have the stress, it's not a problem. So in our day-to-day practice, I do see it as a pretty common cause. Now, how do we navigate that problem is the question, because we have to, of course, otherwise you would keep resorting yourselves to things like IUI, IVFs. Now that becomes two big procedures. Why not have something simple, something, more natural, which you could do at home, which would help you procreate. So therefore, with that in mind, I wanted to discuss about intravaginal inseminations today. Now, the whole concept around self-insemination came in, once people saw that IUIs were working. So that means there would be couples who are not even trying naturally. However, intrauterine insemination helps them get pregnant. From that, the extrapolation was basically that you don't really need an intercourse per se to happen or an orgasm to happen. You just need the sperms, healthy sperms, to get inside the vaginal tract. With that in mind, now therefore, these IUI cannulas are used as insemination catheters. So it's very simple. You could actually just procure any, it's better than syringing. So you could just have an intrauterine insemination cannula, which are known as IUI cannulas, and a specimen container for the, husband or the male partner. So basically the couple, what they do is the husband would produce a sample at home and then load the sample in the IUI catheter. And then as doctors, we tend to inseminate it inside the uterus. Obviously, as a couple, you can't do that. So you would just inseminate the sample inside the vagina. Now, this very simple procedure actually acts as a boon for couples where they find that it's difficult to conceive, as I said, in cases with obvious issues like vaginismus and erectile dysfunction. Also, I've seen in my day-to-day practice that couples who are having a psychological issue, having an insemination kit at home, it actually acts as a very good backup with them, which means otherwise, couples are always very tense that, for example, they might have done a follicular study or done some ovulation testing and they know today is the day of ovulation. And it's so much wired in the minds of both, both the wife and the husband that sometimes it becomes very difficult to actually try. In such cases, when the couple has, an insemination kit at home, it's extremely useful, because in that case, you say that, okay, I have a backup plan available. God forbid, if I feel that on that particular day we're having some issue, in that case, you could just go ahead and use the insemination kit. So I just wanted to talk about this topic, though a less talked topic, but when people attend our clinics, for example, they think they're the only couples struggling with such an issue. Let me tell you, it's a much more commoner issue than people, want to believe it to be. And therefore, we should all be forthcoming in talking to our doctors about it. And as I said, just try these simple self-insemination kits. They're very cheap. They're not more than like $500. The whole kit, which is an IUI cannula and the speci container. It's much cheaper than the IUI. You don't really need to even visit doctors for that. It is something very simple to start off with. So I wish you all the best, and I would want you to try that if you think it helps you onto your path to natural conception. Thank you. Okay, so we'll take some questions posed by our viewers on Fertility Fridays. So Khushbu Kumari Pandey saying, "Hi ma'am, मैं खुशबू पांडे, मेरा PCOS है, आपने नॉर्मल ट्राई करने को बोला था, बट अभी नो रिजल्ट, आई एम वेरी सैड। 16 जैन को प्रेगनेंसी टेस्ट भी नेगेटिव आया था, अब क्या करना है?" अब खुशबू देखो, PCOS का मतलब है शायद एग ठीक से हमारा नहीं बन रहा है। तो हर वीडियो में जैसे मैं बोलती हूँ, हर पेशेंट को भी बोलती हूँ कि देखो इन सब चीजों का सक्सेस रेट 20-25% होता है। तो हमारे को यहाँ पेशेंस बहुत रखना है। एक महीने में अगर वर्कआउट नहीं हुआ, इसका मतलब ये नहीं है कोई मेजर प्रॉब्लम है। प्लीज इसी चीज पे वर्क करते रहो। ओव्यूलेशन इंडक्शन जिसको हम कहते हैं, कभी कभी एक साइकिल में वर्क करता है, कभी 3 से 6 साइकिल्स लगता है, बट प्लीज इस पे आप ट्राई करें। माही पुरु कह रही है, मैम आई एम ऑन 12th डे आफ्टर FET, व्हाई एम आई हैविंग एब्डोमिनल पेन एंड बैक पेन? I am also on injections. This pain is sometimes more, sometimes less. So, Mahi, again, see, these symptoms are known as non-specific symptoms. Sometimes we say even a little bit of bleeding, spotting, or some mild pain could actually be a very healthy sign of implantation. Sometimes, yes, it could also be the sign of an onset of a cycle. So, rather than going on non-specific symptoms, you're already on day 12. If it's been a blastocyst transfer, you should be coming positive on the test. So, all the best. Do the test today or tomorrow and find out. These non-specific symptoms, even bleeding, I would say, is not necessarily a negative symptom. So don't worry. Vani Najma कह रही है, thank you so much doctor. How to try for conception in irregular periods? Najma देखो, first we have to do a follicular study or some ovulation test to know what is our fertile window. And in irregular periods, if a lot of times it is not happening on the correct time, then you need a little medical help. You need to take medicines, and then you need to do ovulation monitoring, preferably follicular studies, which will help you time your fertile window. So please do that, because with irregular periods, otherwise we're really not sure, how this is going to work out. So another user is saying, hello ma'am, मेरी ultrasound report में ecogenic focus in left ventricle है, उन्होंने कहा है नॉर्मल है, बट आप बताइए। तो मैंने पहले भी जैसे वीडियोस में बताया है, इंडियंस में स्पेशली 8% लोगों में हार्ट मसल्स में कैल्सिफिकेशन देखा जाता है, जिसको हम इकोजेनिक फोकस कहते हैं। अगर एक अच्छे फीटल स्पेशलिस्ट ने देखा है, आपके बाकी सारे जेनेटिक टेस्ट लाइक डबल मार्कर, पेंटा मार्कर, मे बी एन NIPT कैन बी डन, अगर नॉर्मल है और ग्रॉसली स्ट्रक्चरली बच्चा अल्ट्रासाउंड पे ठीक दिख रहा है, तो हम इसको इग्नोर करके आगे फॉलो अप कर सकते हैं। ठीक है, thank you very much for your questions. If you also have any question, please feel free to click on the link below or write below in your comment section. We will definitely get back to you with the answers. Thank you.